The Treatment Action Campaign's Ritshidze Report details the shortcomings of the Free State Department of Health. Some of the challenges faced by the department include long waiting times, staff shortages, the poor condition of infrastructure, medicine stockouts, and a violation of patients' privacy. Staff shortages remain critical and undermine the quality of healthcare services provided to patients. Ritshidze found that only 21% of the facility managers interviewed reported that they'd had enough staff to meet the needs of patients. Anele Yawa, General Secretary of TAC, joins us now to tell us more. Anele, good to speak to you. It is pretty clear that things are looking a little bit dark, if you will.
Good morning to you and the viewers at home. Yes, as you have alluded, that things are not looking right in Free State, especially in the facilities that we have monitored, which includes Lijwali Putswe, Thabo Mofokeng and Mangaung. But also the problems that, the challenges that are presented on the Ritshidze Report does not only speak about those facilities only, but also it gives a picture of what is happening in other facilities on all the issues that we have listed, starting from staff attitude, long waiting hours, human resource for health, the state of our clinics, which needs to be renovated, and also the other challenges that most of the facilities that we have visited, we have since realized that we have a lot of acting facility managers. And the question we're asking ourselves, when are these facility managers are going to be appointed on permanent basis, including issues that are related to access to water, and also number of issues like the expectation now, because of COVID and all what have you, the expectation is that people living with HIV, TB, and other chronic illnesses will be given a monthly month supply, where they will not be compelled to go to clinics on monthly basis. At least if people can be given a 3-month supply of their treatment, it means then they won't be forced to go to clinics for the next 3 months, which will reduce the number of people who are overcrowding our clinics. But also the issues of people who are stable on their treatment. Why are these people not decanted to go and collect their medicines in pickup points? So that is how the situation is in Free State. But also the good thing about it, we had a meeting with the HOD of Free State 2 days before we released the report, and he committed that we are going to have a meeting in the next 2 weeks where we will go through the report and agree together as to say, how are we going on the ground together to fix the problem?
But Anele, the things that you speak about are things that any medical practitioner should know. So is it a case of unwillingness to abide by these standards? And I'll tell you this, a month ago we had a similar Ritshidze report on Limpopo, and the very same things that you are bringing up came up in that report.
Yes, and what does this mean? It actually shows us a trend of what is happening within the Department of Health across the country, to say these problems that we are picking up in Free State are similar to the problems of Limpopo, are similar to the problems of Gauteng, are similar to the problems of Northwest, are similar to the problems of Eastern Cape and other provinces. And the question we must ask ourselves now, as the public healthcare users, if we are having all these problems, they have been identified, but how are we coming on board in terms of trying to engage with the duty bearers, to engage with our government? Because at the end of the day, in South Africa, we've got a constitution. Section 27 of the South African Constitution gives us the right to access quality healthcare services. And if these rights, then we are denied them when we go to the facility, what must be done? That's why now, as Ritshidze and all other progressive forces, we are engaging directly with the HODs, with MECs, so that these problems can be resolved on the ground. Because if health is a fundamental human right, therefore it means something must be done. And also some of the challenges that we are picking up on the ground, which contributes to these failures, are issues related to corruption, where a lot of money is being stolen, cadreship deployment, where people who are incompetent because of their close proximity to certain politicians, they are being appointed into positions where they are unable to deliver. So there are a lot of problems. Like one of those problems, we are supposed to have clinic committees and hospital boards. These clinic committees are supposed to be a bridge between the community and the facility. And when we go to on the ground, you find out that clinic committee never had a meeting for the past 7 months. And the question we're asking ourselves, what does Section 42 of the National Health Act says in the event that clinic committees or hospital boards are not functional? When are the MECs of health are going to exercise their power as it is stipulated on the National Health Act to make sure that people who are appointed in clinic committees are not people who are friends of ward councillors, but are people who have a better understanding and the interest of fixing the broken public healthcare system? Because the problem we have now that makes clinic committees and hospital boards not to be functional is because majority of clinic committee members are people who are deployed by councillors, but not people who've got the best interest of the people in terms of fixing the problems on the ground. So there are a lot of problems that we are having in our country when it comes to the state of healthcare services.
Clearly, Anele, now your strategy obviously is you're going province by province and dealing with these situations, these issues at ground root level. But the problem is national. Clearly, if we look at the Ritshidze Report, this current report, and certainly a couple of reports that I've read, the problems are national. Should you not be approaching the Department of Health at a national level in order to deal with the problems from that perspective?
Yes, you are right. But also, on the other hand, you must understand that we've got only one country. South Africa is one country, but we've got about 10 different departments of health when you count the national and 9 provinces. MECs of health and provinces have powers on some areas, and the Minister of Health does not have powers in some areas when it comes to provinces, like issues that are related to budget. That is the responsibility of the province. Issues that are related to human resource, issues that are related to renovation of clinics and building of new clinics, issues that are related to purchase of healthcare services. Those issues sit with the provinces. That's why now, as we're moving out to the provinces, we want to engage provinces about what is on their mandate as provinces. By the time we get to the National Department of Health, we will know exactly as to say we are engaging with the National Department of Health on issues that are related to the National Department of Health. We have already written to the new Minister of Health requesting to have a meeting with him and his department so that we can be able to discuss about the challenges our country is facing. Because if you've got people like former ministers, Ritshidze, who looted, let me say it like this, who looted about more than 100 million and gave it to his friends, companies, to Digital Vibe, the question we must ask ourselves, is the country having a problem with budgets, or the problem that we have in the country, people who are on top positions are not prioritizing what needs to be done, but they are prioritizing their own agenda? If that 100 and something million that was given to the Digital Vibes was invested or injected to fix the problems that we have in our provinces, for sure, some of the challenges could have been addressed. But the problem we have in our country, people like your ministers, your HODs, and all what have you, when they are planning and budgeting, they don't prioritize areas that has something to do with improving the quality of services and healthcare services in our country. So that is the narrative now, as TAC, as Ritshidze, as NAPWA, as Positive Women's Network, as Positive Action Campaign, and as Sanarela, we are working towards it. And if it means, as these organizations, we need in South Africa to establish a public healthcare users mass movement. Let it be, because the public healthcare users of our country do not have anyone to speak for themselves. That's why people, when they go to clinics, their rights are being violated, because those people who violate the rights of the public healthcare users, they know that if we shout at Anele today, Anele does not have anywhere to go to lay a complaint. The complaint box that are supposed to be in our clinics are not working, because the facility managers are the ones who are opening this complaint box, and they don't revert back to the one who laid the complaint to give them a feedback. That's why now we are saying we are going to change the gear and take full responsibility and full control of what is meant for us according to the Constitution, in terms of ensuring that we improve the quality of healthcare services, so that all the citizens of the country, those who work in South Africa and those who stays in South Africa, enjoys what is under Section 27 of our country's Constitution.
And final question. Let's talk about those individuals that are on chronic medication. Has COVID-19 and the entire vaccination process impacted how those people have been accessing those medicines?
Yes, and that it has affected them badly, because you will remember that early last year and late last year and towards early this year, we have seen a number of clinics where, because of inadequate PPEs for healthcare workers, gates were closed and they were taking people in clinics on certain numbers. But one of the challenges that we have seen in some clinics, where security officers were standing on the gates, taking people's medical files and also going inside and bring back the medicines of the people, we felt that other people who were not yet ready to disclose their status were made by these conditions their status to be known, because there was no confidentiality when people were given medicines. I will see Anele being given medicines in a blue bottle, and I will know then it means that Anele's status is disclosed. But also, because of the COVID, many people could not get enough medicines. Like in some areas, you find out that instead of Anele being given a 1 month supply of treatment, Anele will be given a supply of 2 weeks, and then Anele will be requested to come after 2 weeks. In some areas, people living with HIV were switched from their treatment and given another treatment without them being taken into confidence in terms of making them understand the side effects of the treatment and all what have you. So there were a lot of problems that we have seen in our clinics, which affected access to medicines. That's why now we are saying, let's sit down, government. Let's identify as to say, if Clinic 1 does not have enough medicines, how best can you go to Clinic 2 and borrow those medicines to make sure that at the clinic, nobody goes home empty-handed without getting their medicines. But also the looting, which happened in areas like KZN and as well as in Gauteng, also affected, because you will remember that in some areas there were these ATMs where people were able to access their medicines, and in other malls there were pick-up points where people will go and pick up their medicines. But in some areas like in KZN and in Gauteng, those malls were banned and they were looted, and as a result of that, many people were unable to access their medicines. They were forced to go back to their clinics, and then that's where now we started experiencing problems.
Anele Yawa, Treatment Action Campaign General Secretary, thank you so much for your time.